Yeah, definitely. Probably most of it, unfortunately, is in our genetic makeup. So if your mum and dad had a lot of back trouble and surgery, chances are you might end up needing it. But about 80% people often say it's probably really related to genetic makeup. And as we get older, we're all vulnerable to this. It tends to be in the middle-aged group because as you get much older, the discs get very stiff. So they're much less likely to herniate. But in the younger it's often people in the middle of their working life period and suddenly they're devastating pain. And it's because the disc has been wearing without them knowing it. It's rather like your face changes, and I tell my patients, well, look, now you're 45, it would be a bit odd if you looked exactly the same as you did when you were 14. But when our radiologists look at the scans, they're really comparing the discs that you have at 45 to the scan of somebody who's 15, 16. So of course the discs are going to be different because the spine ages just like the rest of our tissues. So it's nothing abnormal, but it's a sort of design fault that unfortunately is a bit of a weakness, often on one side at the back of the disc, where it tends to come out and then it'll catch the nerves. So weight, being grossly overweight is not a good idea for lots of medical reasons, but it's obviously not good for your spine. And the core strength, the muscles, the abdominal muscles and your spinal muscles are very important in stabilizing the spine. So physiotherapists now often concentrate a lot on core muscle strength work. It's well worth discussing with some physiotherapists who are having a lot of back pain, let alone sciatica. But people with back pain really need to focus on good core strength. People go to Pilates classes and all these things. It's horses for courses. Some will find that suits them, others don't. But I think the emphasis now is much more on good physical core strength, fitness, and general weight, normal diet. You don't have to eat special foods or anything. It's just common sense.